Hello dear students, in this video we are starting our part 3 of the cardiovascular system. In the part 1 I was discussing about the general anatomy and then the ECG. In the part 2 we discussed about the regulatory factors, especially the BP regulation and cardiac output regulation. In the part 3 this is of a very simple topics. We are going to discuss about the regional circulation, then hemodynamics of the circulation, then shock, one of the most important aspects in physiology, then heart failure. So in this regional circulation, there are several circulation which has some special features. So regional circulation means we are going to discuss about a specific region and what are the specialities in it. So if this is asked, you can write about the general control like neural regulation, metabolic regulation and the endocrine and the various metabolites which regulate the blood flow. But here in this videos, what we are going to discuss is we are going to discuss about the specific special features of that particular circulation. So the regional circulation we will be discussing about cerebral, then coronary, then cutaneous, the skin, then splanchnic, the GIT, then placental and fetal circulation. And today this video will be on the cerebral circulation. So what are the special features that we see in the cerebral circulation? That's what we are going to discuss. So coming to the cerebral circulation, and cerebral circulation, how it is getting the blood flow? The blood flow is primarily from the arteries, that is the internal carotids, two internal carotid artery and two vertebral artery. This anatomical details you would be already knowing it, vertebral arteries. Now what they are going to form is, they are going to form a specific structure in the brain which is called as the circle of Willis. So this circle of Willis is an anastomosis between these four arteries. So this circle of Willis is formed by two internal carotid and the two vertebral arteries. So with this knowledge, now let's try to understand what are the special features of this cerebral circulation. So here it has a high blood flow requirement. Naturally also at baseline, when even at the resting condition, the cerebral is one of the most vital organ. So it will be taking out around 13 to 20% of the cardiac output. In the previous exercise physiology video itself, we saw at baseline it takes around 13% and it amounts to around 750 ml. So that is a huge supply, 750 ml per minute. Even at baseline, it is receiving a huge amount of blood, that is a high blood flow requirement. Its weight is just 2% of the body, but still it is requiring a high amount of blood. Even when the person goes for an exercise, what is going to happen? This amount of blood is going to be maintained and the supply is going to be maintained. And this high metabolic demand needs continuous oxygen supply to the brain, because the brain is highly sensitive to hypoxia and glucose supply also. Next thing is, it has a tight autoregulation. So what are the changes in the blood pressure in the periphery that will not impact the central nervous system immediately? For example, when the mean arterial pressure changes from 70 to let's say 150 mm of Hg, at these levels, whatever the change is happening, the cerebral blood flow is going to be maintained constantly with the help of a strong auto-regulation. Why this is happening? Because the 70 mean arterial pressure is a low BP. Even at that time, the brain should not go for an hypoxia. So it prevents ischemia whenever there is a low BP. And 150 is high mean arterial pressure, because the normal mean arterial pressure is around 90 to 100. And 150 is high to prevent the hemorrhage at such high BPs also. That's why when we see the patients of hemorrhagic stroke, stroke is the condition where it can happen due to ischemia also and hemorrhage also. Whenever you see a hemorrhagic stroke patient, their BP levels are generally beyond 200 mm of Hg. And the brain auto-regulation will happen till 150 only. Beyond that, it cannot auto-regulate, so hemorrhage can happen. Then blood-brain barrier. All of you must be aware of this particular barrier. It helps to prevent the toxic substances from entering the neural tissue, because neural tissue is very, very important. So it prevents the entry of this toxic substances. So blood-brain barrier is a very specific and special feature of the cerebral circulation. Then collateral circulation, which I have already discussed. These arteries are forming anastomosis, and that's why they are going to help whenever there is a block at some point of time. But again, the scientists recently have studied that this anastomosis has an equal pressure point on both sides. Even if one artery is being blocked at some point, the other side blood flow is not helping that much. Like it was created for a very nice purpose, but it is not that helpful in a real life scenario. Next is high oxygen extraction. Normally, when you see some of the tissues, the oxygen extraction will be around just 20%, but this has a high oxygen extraction, like 30 to 50% of oxygen extraction. Whereas in the cardiac tissue, it is very, very high. We will be reading the coronary circulation. There you will see an extraction ratio of 70 to 80%. But still, here also there is high extraction ratio in comparison to the other tissues. Then CO2 sensitivity. The cerebral blood flow is one thing that is highly responsive to CO2. And whenever any patient is having hypercapnia, that is an increased CO2 levels, and it is a heavy stimulant for the central nervous system, especially the respiratory centers. This hypercapnia will cause something called as vasodilation, and it stimulates the respiratory center also. So it causes vasodilation because of the metabolite, that is the CO2. And whenever there is an hypocapnia, it can cause vasoconstriction. This does not happen generally. Many a times it is the hypercapnic condition which is causing a vasodilation. This many a times will be seen. Next thing is, there is absence of lymphatics. Whenever you are drawing a diagram of the brain, most of the time, not most of the time, almost all the time, you would have never drawn any lymph nodes in the brain, because the brain as such does not have a lymphatic system. Like all other organs in the body has a lymphatic system. So how does it get rid of the metabolites? For that, there is one special fluid which is circulating in the brain. All of you know that it is CSF. This cerebrospinal fluid is going to drain the metabolites or any unwanted substances. And this CSF, whenever it is draining that, this is called as glymphatic system. It is very, very specific to the brain, glymphatic system. So again, this is important. Then Munro-Kelly doctrine. What is this Munro-Kelly doctrine is? All of us know that the cranial vault, the size of the cranial vault after a certain time of age, even after 2 years of age or 3 years of age, it is going to have a fixed cavity. The cavity is not going to expand after that. So what is going to happen? There are some elements present in this cavity and the space is already fixed. So what happens is, when one thing increases, it is going to compress the other. Let's try to understand what are the substances which are inside. One is the brain tissue itself, then we have the blood vessels, then we have the CSF. Out of this, if one is increasing, for example, let's assume there is a tumor in the brain that is increasing in size. What is going to happen? It is going to compress the blood vessels because the cavity is fixed. Their volume is constant. They should have a constant volume. In a similar manner, whenever the CSF is increasing, for example, there is a obstruction in the ventricles, because the ventricles are going to drain the CSF, there is some obstruction. So now the CSF is getting accumulated in the brain. So what it is going to do is, it is going to compress the other. So this specific type of mechanism which is happening in the brain, where one increase in one of the volume will reduce the other volume, is called as the Munro-Kelly doctrine. It is an important principle. Sometimes whenever the brain is going for a severe hemorrhage, what is going to happen? Now the hemorrhage, the blood is leaking and the blood is occupying the space. So it is going to compress the brain tissue and it can lead on to herniation into the foramen magnum. The brain can herniate into the foramen magnum. That level of severe thing also can happen whenever the increase in blood leakage or CSF happens. Next comes the venous drainage system. The venous drainage system for the central cerebral circulation is, it is going to be the dural venous sinuses, which in turn is going to give into the internal jugular vein. What is so special about this venous system is, there is no valve present. The flow is bidirectional. That is why whenever the danger triangle of the nose we are getting affected, that infection can spread into the central nervous system because of the venous system. So this is again a special feature of the cerebral blood flow. Next, it is highly sensitive to hypoxia. Whenever we are doing a blood pressure, what we are doing? We are compressing the artery here and momentarily we are stopping the blood flow. But our hand will have some symptoms, but it does not go for hypoxia or ischemia. But in the case of CNS, the central nervous system, what's going to happen is, whenever there is a hypoxia, the blood flow is stopped even for less than 10 seconds, the patient will have a unconsciousness. And if it is prolonged for a minute, the patient can have a nervous damage itself. So they are highly sensitive to hypoxia. Then the major source of energy is glucose. But here the brain has one beautiful advantage. Here the glucose uptake happens with the help of GLUT1 transporter. So there are several GLUT transporter, and what is so special about this GLUT transporter is this is non-insulin dependent. It is not dependent on insulin. Why? Because such a vital organ like a brain, we don't want it to depend on insulin. So that's why it is using a different type of transporter through which the glucose can be transported all the time, because the brain should always have the energy, and that is a vital organ. Then the brain is highly sensitive to ammonia because it is highly toxic to the brain, and many times when you read about renal pathology, there is something called as hepatic encephalopathy. What happens in hepatic encephalopathy is, here the liver is damaged. Because of the liver damage, it is not able to detoxify. So the ammonia accumulation is happening, and that is going to the brain, and it is causing the damage to the brain. And even during an activity, one more important classical feature is, which I have already told you in the exercise physiology, cardiovascular changes in exercise. It is going to be same during rest as well as during an activity. Generally, what happens in activity? There is a vasodilatation happening to the exercising muscle, and it will increase the flow. But the brain at baseline itself, it is having a good amount of supply. Even when activity is happening, suppose you are thinking, you are visualizing something, what is going to happen is the blood flow is going to remain the same. How the brain is able to manage this supply is because now the brain, what the brain will do is, suppose for example, you are looking at a visual stimulus. What cortex is going to be stimulated? Your occipital cortex is going to be stimulated at that point of time. Now the blood flow will be redirected to the occipital region. Overall, if you see, everywhere it is receiving, total is 750 only. But wherever the requirement is happening, the blood flow to that particular area will be diverted from the other area. So if you are looking at an object through a visual stimulus, what is going to happen? Occipital cortex is going to get more blood supply, and the other regions of the blood, it will be diverted from the other regions to the occipital region. How they have understood this concept is, they have done something called as functional MRIs. Now they showed the patient or a subject with multiple visual stimuluses. At that time, you can see here the red blaring ones are the functional areas which is having the blood supply. As you can see here, this area's blood supply is increasing whenever there is a visual stimulus or the occipital is increasing. So that's how they are able to know that even though the brain is having a same amount of blood supply, depending upon the activity regions, it is going to be redirected to the region where it is highly active. Next, so there are some methods to measure about the blood flow. A quick recap about the headings I will say. So first one is, the brain is having a high blood flow requirement, and it is having a tight autoregulation. Then there is blood-brain barrier, then there is collateral circulation, then high oxygen extraction, then it is highly sensitive to CO2 as well as ammonia. Then there is no lymphatic present, whereas in case of other elimerals, the lymphatics are present. And there is one special law called as Monroe-Kellering doctrine. But in other areas, it tends to expand. It doesn't cause this type of compression because the cranial vault is a fixed volume. This is important. And the venous drainage, again it is special because it does not have valve, it has a bidirectional flow, and it is highly sensitive to hypoxia, and glucose is a major source. Now we are going to discuss some of the techniques through which the cerebral blood flow can be measured. In the cardiovascular system itself, I have discussed one principle which is called as Fick's principle. It states that it is the amount of substance given or absorbed by that particular organ upon the arteriovenous difference. So here the formula is the same. There we are using, for a cardiovascular system, we were using the oxygen as the gas. But for the cerebral circulation, we are going to use a special gas, that is nitrous oxide. Whenever nitrous oxide is used as a gas to estimate the cerebral blood flow, that method is called as KT method. So KT method is simple. It is the same Fick's principle only. The gas used here is changed, nitrous oxide. If you use a nitrous oxide, then that particular method is called as KT method. Then we can also use radioactive substances like xenon or positron emission tomography, that is nothing but the PET, or other functional MRIs. Functional MRI is going to highlight the areas where it is functioning. So that is what I have shown the picture in the previous page itself. I hope it's clear. So cerebral circulation, as you can imagine, it has a vast variety of individual features which is not seen elsewhere. For example, many of the organs will have autoregulation, but other features which are not seen elsewhere is seen in the cerebral circulation. I hope it's clear. Thank you for watching the video. In the next video, we are going to discuss about the special features of coronary circulation. Thank you so much.